ADHD at a glance. Let's start with a brief history. In 1798, Sir Alexander Crichton noticed that some children were easily distracted and unable to focus like others. However, it wouldn't be until 1932 when Franz Kramer and Hans Polno would describe hyperkinetic disease. This would be where children couldn't stay still, disturbed classes, had problems with other kids. This would usually be noted around kids between the ages of 3 and 4 and would peak at age 6. However, this restlessness would get less intense as they grew. Or so they thought. In 1937, Charles Bradley noticed that benzaprine did cause some improvement, allowing children to behave better and improve performances. Later on in 1944, methylphenidate was first made, and later in 1954, it would be remarketed as Ritalin and would be used to treat chronic fatigue, depression, and other ADHD symptoms. Later on, in 1980, the American Psychology Association would rename the hyperkinetic reaction into attention deficit disorder, what we know as ADD, but it did add 2 variations. ADD was hyperactivity and ADD without hyperactivity. In 1987, the APA would change ADD to Attention Deficit Hyperactivity Disorder, or ADD, and would group inattentiveness, impulsivity, and hyperactivity together. In 1994, though, the DSM-IV would later list these 3 as different types of ADHD, and would also acknowledge that these symptoms didn't just go away in adulthood. Now, ADHD is a chronic and debilitating disorder that impacts academic and professional achievements, interpersonal relationships, and daily functioning. This typically leads to poor self-esteem, sensitivity towards criticism, and even an increase in self-criticism. In studies, it showed that 11.4% of children in the U.S. would be diagnosed with ADHD, although boys were more likely to be diagnosed than girls. And 78% of these children with ADHD would go on to have a co-occurring condition, almost 50% of which would be a behavior or conduct problem, with 40% of them also having anxiety. Now, as previously mentioned, there are different types of ADHD, and this can actually determine some more of the symptoms. In inattentive ADHD, the symptoms include more along the lines of not paying attention, problems staying focused, they don't seem to listen when spoken to, quickly lose focus, trouble organizing things, and losing things very easily. And hyperactivity is more characterized by excessive movement and making decisions without thinking through the consequences. And ADHD can also be ranked based on its severity, mild, moderate, or severe. It is also common for other mental health conditions to mimic ADHD symptoms, as well as other mental health disorders and conditions to coexist with ADHD. These include conditions like anxiety, substance abuse, head injuries, thyroid conditions, oppositional defiant disorders, conduct disorders, and learning disorders, to name a few. Unfortunately, it is not known what specific causes of ADHD are, but there is believed to be some genetic contribution. Unfortunately, there has been no scan or genetic screening that can be used as of now to diagnose ADHD, although some studies have suggested that the frontal lobes, the caudate nucleus, and cerebellar vermis of the brain are affected. Likewise, psychostimulants and noradrenergic tricycles have proven helpful in ADHD treatment, leading many to believe that neurotransmitters play a role. Supporting this theory is the fact that medications that help facilitate the release and function of dopamine and adrenaline. As of 2022, 30% of children with ADHD didn't receive the medication or behavioral treatment they needed. When diagnosed by a mental health or primary care provider, it involves a psychiatric evaluation, and they may even be referred to medical evaluation to rule out any other complications. although it is widely believed that it's important to use a combination of both therapy and medical interventions when treating ADHD. Psychostimulants like amphetamines are the first on a pharmacological treatment. Behavior management strategies are also used to minimize distractions and increase structures. But regardless of what technique is used, family support is crucial for patients. For parents of those with ADHD, it is also recommended to implement behavioral strategies through parent management training and school intervention in younger children. For those educators, they can help the parents and doctors by providing information that help them evaluate behavior and learning problems. However, it is important to remember that school staff cannot diagnose or treat ADHD.